CNA PPE donning and doffing. Welcome to the quiz. Question 1. You are assisting in the collection of various laboratory specimens from patients in your unit, and you are reviewing the proper technique for handling and labeling specimens to ensure accurate test results and proper identification. You are holding a urine specimen that has been collected from a patient for urinalysis testing. Based on proper specimen labeling protocols and standards for identifying patient samples to ensure they are processed correctly and the results are attributed to the correct patient, where should you label the specimen container? Option A. You should only label the lid of the container with the patient's name, as the laboratory will not look at the sides of the specimen cup. Option B. You should label the side of the specimen container with the patient's full name, medical record number, date and time of collection, and your initials, following your facility's specific labeling requirements. Option C. Specimens do not require labels, as the laboratory will identify them based on the order in which they are received. Option D. The answer is B. Specimen labeling is critical for patient safety. The label must be on the container itself, not just the lid. Lids can be swapped. Option B is correct. Option A is wrong because lids can be misplaced or mixed up. Option C is dangerously wrong. Specimens must always be labeled. Question 2. You are caring for Mr. James Wilson, a 76-year-old male patient who is bedbound and cannot independently turn or reposition himself in bed. He has been in the same position for several hours, and you know that prolonged pressure on specific areas of his body puts him at significant risk for developing pressure ulcers. You understand the importance of frequent turning and repositioning. When considering the primary reason for frequently turning and repositioning bedridden patients who are unable to move independently, which statement most accurately describes the main goal of this activity? Option A. The primary reason for turning and repositioning patients is to give them something different to do during the day so that they will not become bored during their hospitalization. Option B. The primary purpose of turning and repositioning is to prevent pressure ulcers from developing by relieving prolonged pressure on specific body areas and promoting adequate circulation to all parts of the body. Option C. The main reason for turning and repositioning is to provide an opportunity to change the patient's bed linens and complete room cleaning while the patient is being moved. Option D. Turning and repositioning are primarily done to give family members an opportunity to visit and interact with the patient while the patient is being moved to different positions. The answer is B. The primary goal of repositioning is pressure ulcer prevention. Option B correctly states this. Options A, C, and D are secondary benefits at best, not the main clinical purpose. Question 3. During your shift, Mrs. Sarah Anderson, a family member of one of your patients, approaches you in the hallway and asks you detailed questions about her relative's medical diagnosis, current medical condition, prognosis, and specific details about the treatment plan. She seems very concerned and wants to understand everything about her relative's healthcare. You want to be helpful and responsive to the family member's concerns, but you also understand the importance of maintaining appropriate communication boundaries and ensuring that confidential information is handled properly. When a patient's family member asks you about the patient's medical condition and diagnosis, what should you do? Option A. Provide the family member with complete and detailed medical information about the patient's condition, diagnosis, treatment plan, and prognosis, as family members have a right to know all details. Option B. Refer the family member to the nurse or appropriate healthcare provider, as it is the nurse or physician's responsibility to discuss the patient's medical condition and answer specific questions about diagnosis and treatment. Option C. Tell the family member that you cannot discuss the patient's medical information with them and suggest that they speak with the patient if they have questions. Option D. Share general information about the patient's condition, but avoid mentioning any specific diagnoses or treatments, to provide some information without giving away too many details. The answer is B. CNAs are not authorized to provide detailed medical information or diagnoses. That is the role of the nurse or doctor. Option B is correct. Option A is a breach of confidentiality and scope of practice. Option C is not helpful. Referring to the patient may not be appropriate if the patient is confused or unable to communicate. Option D is still inappropriate. Any sharing of medical details without proper authorization can violate HIPAA. Question 4. You are orienting a new nursing assistant to your unit and reviewing important admission procedures and activities that should be performed when a patient is newly admitted to the hospital. You are discussing with her the important initial hygiene and personal care activities that should be provided as part of the admission process. Based on standard admission procedures and protocols for promoting patient comfort and cleanliness upon arrival to the hospital, which hygiene task should routinely be performed for all patients upon their admission to the hospital? Option A. A complete head-to-toe bed bath should be performed on all patients, regardless of whether they can shower or bathe independently, as this is always required during admission. Option B. Hair washing should be performed immediately upon admission, even if the patient is very ill or unstable, because hospital policy requires all patients to have clean hair. Option C. An initial bath or shower should be offered and performed if the patient is physically and medically able to do so, both to promote cleanliness and to allow the patient to feel fresh and comfortable after traveling to the hospital. Option D. Nail trimming should be performed as an immediate priority during admission, as long nails can cause injury to the patient and other staff members. The answer is C. Upon admission, an initial bath or shower is offered based on patient ability and preference. Option C is correct. Option A is incorrect. Not all patients need or can tolerate a full bed bath. Option B is incorrect. Hair washing is not an immediate priority and can be unsafe for unstable patients. Option D is incorrect. Nail trimming is not an admission priority and may require assessment. Question 5. You are providing care to Mr. Richard Hopkins, a 68-year-old male patient who is hospitalized for acute illness. During your shift, he refuses to allow you to assist him with bathing, tells you that he does not want to take his medications, and refuses to allow you to reposition him in bed or assist with range of motion exercises. He states clearly that he does not want these care activities performed. He seems anxious and states he wants to be left alone. You recognize that patients have the right to accept or refuse care, and you need to handle this situation appropriately while respecting his autonomy. When a patient refuses care or treatment that has been ordered by their healthcare providers, how should you respond? Option A. Force the care to be provided anyway, as medical orders must be followed regardless of what the patient wants, and you have a responsibility to ensure all ordered care is completed. Option B. Respect the patient's wishes and refusal of care. Document his refusal in the patient chart, and notify the nurse immediately so that the refusal can be addressed and the reasons explored. Option C. Tell the patient that he must comply with all medical orders and that refusal is not acceptable, and threaten to report his behavior to the doctor if he continues to refuse care. Option D. Document that the patient is being uncooperative and unruly, and avoid that patient for the remainder of your shift while hoping he will change his mind. The answer is B. Patients have the legal and ethical right to refuse treatment. Option B is correct. Respect the refusal, document it, and report it to the nurse so the nurse can reassess and educate. Option A is assault. Option C is coercive and disrespectful. Option D is abandonment and fails to address the situation. Question 6. You are preparing to change the bed linens for Mr. George Martinez, a 71-year-old patient whose bedding has become soiled with urine and feces due to incontinence. You understand that when handling soiled linens and caring for incontinent patients, specific infection control precautions need to be taken to prevent the transmission of infectious agents from body fluids to yourself, other patients, or the environment. When changing soiled bed linens and providing care to an incontinent patient, which infection control precautions should you use? Option A. No special precautions are necessary when handling soiled linens, as long as you wash your hands at the end of your shift. Option B. You should use standard precautions including wearing gloves, handling linens carefully to avoid dispersing contaminants into the air, placing soiled linens in designated containers, and performing appropriate hand hygiene after care is completed. Option C. You should wear a full hazmat suit including respirator, goggles, and all protective equipment because urine and feces are extremely dangerous. Option D. You should wear only a surgical mask without gloves, as the mask will protect you from any infectious agents present in the soiled bedding. The answer is B. Standard precautions apply for contact with body fluids. Gloves are essential and soiled linens must be handled to minimize contamination. Option B is correct. Option A is wrong. Hand hygiene alone is insufficient. Gloves are required. Option C is overkill and unnecessary. Option D is wrong. A mask does not protect hands from contamination. Great job! Don't forget to subscribe. Bye.